Hi everyone, this is Dr. Abhishek Samdesi, and I have done my MD Respiratory Medicine. And welcome back to Pulmonology Simplified. Today we shall discuss regarding part 2 of ABG Simplified, which is Physiology of Acid-Base Balance. Firstly, I want to thank each and everyone for the immense support that I have received for this channel. Now let's discuss regarding the ABG Simplified series. Initially, I told that I would be making 4 parts of ABG. But ABG is so vast that 4 parts are not enough, and hence I've divided it into 7 parts. Let's have a look at the video index. Part 1 of ABG we have already discussed, which is the introduction to ABG. Part 2 we shall discuss today, which is Physiology of Acid-Base Balance. Part 3, 4 will deal with the pathophysiology and clinical manifestation of acid-base imbalance. Part 5, 6, 7 shall deal with interpretation of ABG. Let's begin with ABG Simplified Part 2, Physiology of Acid-Base Balance. Why is this topic important? This topic is very much important because if we have to know what is abnormal, we should know what is normal first. Hence, we shall discuss regarding the physiology of acid-base balance. Let's have a look at the contents. The physiology of acid-base balance I have divided into 2 parts. The first part is the basics of acid-base balance, and then the second part is how the pH is regulated. Let's begin with the first content, which is the basics of acid-base balance. The following are the contents. Here we shall discuss regarding the hydrogen, what hydrogen is, what is pH, the role of hydrogen ions in a human body, and then we shall briefly discuss regarding what is an acid and what is a base. Let's discuss regarding hydrogen. What is hydrogen? Hydrogen is a colorless, tasteless, odorless, abundant gas that is present in the nature. Hydrogen is a chemical element which is very abundant, and it is the lightest element with an atomic number of 1. Let's discuss regarding the hydrogen atom. Now, the hydrogen atom has a nucleus which is made up of a positive charge called the proton and a negative charge called the electron. The hydrogen ion is synonymously associated with the name called proton. But what does hydrogen stand for? Hydro means water, gen means generation. Hydrogen is an element that, when combines with oxygen, forms water. So that is why it was named as hydrogen. An element which results in generation of water is called hydrogen. Now, why am I discussing so much regarding hydrogen? Hydrogen essentially is present everywhere in the body, in every compartment, may it be intracellular or extracellular. Hydrogen ion plays a vital role in maintaining pH, pH in the subsequent slides, and the role of hydrogen as well. The concentration of hydrogen ion in human body is 4 into 10 power minus 5 milliequivalents per liter. To get a rough estimate regarding the concentration of hydrogen ion, let us compare with the other ions like potassium or sodium. Potassium is predominantly a intracellular ion. The concentration of potassium in blood is about 3.5 to 4.5 milliequivalents per liter, whereas sodium is 140 milliequivalents liter, plus or minus 5 milliequivalents per liter. Compared to the concentration of sodium and potassium, the concentration of hydrogen ions in the human body is extremely less. Despite such a low concentration of hydrogen ions in the human body, it determines whether the individual is going to have a normal physiological function, or the individual can end up with life-threatening conditions including death. We discussed regarding hydrogen. Now let's discuss regarding what pH is. pH stands for potential of hydrogen. The pH is minus log of hydrogen ions. The pH value is inversely proportional to the hydrogen ion concentration. It means when the hydrogen ion concentration increases, the pH value is low. This is called as acidosis. Whereas if the hydrogen ion decreases, the pH increases. This is called as alkalosis. Let's have a look at the normal pH. The normal pH in human body ranges from 7.35 to 7.45. Any fluctuation of this normal range of 7.35 to 7.45 shall result in an abnormal physiological function at a cellular level. So in this normal range of 7.35 to 7.45, higher the hydrogen ion implies that the pH is low. This is called acidosis. So anything less than 7.4 or less than 7.35 becomes acidic. This is called as acidosis. Anything more than 7.45 shall be called as alkalosis. Conversely, I told that when hydrogen ion decreases, the pH increases, and this term is called alkalosis. This happens when the pH is more than 7.40 or when it is more than 7.45. Let's have a look at the concentration of hydrogen and pH in the body. Let's discuss regarding the extracellular fluid and the intracellular fluid. In extracellular fluid, which is outside the cell, we have the arterial blood, the venous blood, and the interstitial fluid. We are more concerned about the arterial and the venous blood. As we can see, the normal hydrogen ion concentration is 4 into 10 power minus 5 and the pH is about 7.40. Whereas in the venous blood, the concentration of hydrogen ions is slightly higher at 4.5 and the pH is 7.35. In intracellular fluid, the pH ranges between 6 to 7.4. The highest pH is seen in the gastric HCl, which is zero point 0.8, which is very acidic. The role of hydrogen ions. This is extremely important topic in our discussion today. And let us look at the role of hydrogen ions one by one. The first and most important factor is hydrogen determines the pH, acidosis, and alkalosis. If we look back in our chemistry or biochemistry during our first year, we have read that numerous cellular process requires an optimum pH for the enzymes to be active, and hydrogen is the main ion that determines the pH in each and every cell that is there in the body. The other role of hydrogen ion is it affects the surface charge and physical configuration of proteins. Here, I'm talking about the surface receptors as well as the enzymes. And as I told before, pH plays a major role in the normal functioning of these enzymes. So if we apply it on an individual or a human, what it means is if the normal function has to happen, the pH has to be maintained in that range of 7.35 to 7.45. If the pH declines, if the pH becomes more acidic, the enzymes won't be active, the cellular function stops, the cell stops functioning. Here, we are seeing the patient starts dying at a cellular level. This is how we have to apply the role of hydrogen in an individual. The other role of hydrogen ion is in oxidative phosphorylation. Let's have a look at that. Hydrogen ion gradient at mitochondrial membrane is responsible to drive the oxidative phosphorylation forward. What we can derive out of this statement is the difference of hydrogen ion concentration outside the mitochondrial membrane and inside the mitochondrial membrane is responsible for oxidative phosphorylation, which is a main process in each and every cell to generate ATP. If the hydrogen ion concentration is impaired, the balance is lost. What happens is the oxidative phosphorylation is hindered. When this happens, no ATP is generated. When no ATP is generated, the cells do not get energy and the cells die. The patient starts dying from each and every cell. What I am trying to tell is when you see an ABG and see the pH, you have to think in terms of the cellular level on how it is affecting the patient at cellular level. If you treat the patient at cellular level, the outcome is going to be great rather than just treating the patient on the outset. Let's move to the next major role, and the next major role of hydrogen ion is on the oxygen hemoglobin dissociation curve. How does hydrogen affect the oxygen hemoglobin dissociation curve? Hydrogen ions, when it increases, the curve, the sigmoid curve, shifts to the right. What does it mean? It means that the affinity of oxygen with hemoglobin decreases. What it means is the hemoglobin gives away oxygen quite easily. Applying this concept on a patient, say the patient has increased hydrogen ions, so patient has acidosis. What happens to the patient on oxygen hemoglobin dissociation curve? Let us consider this at two levels. One is at the level of alveoli and one at the level of tissues. At the level of alveoli, when the hydrogen ion increases, there is shift of the curve to the right. It means that the affinity of oxygen and hemoglobin is decreased. So whatever the respiratory effort the patient is putting to get the oxygen into the alveoli is not binding with the hemoglobin effectively. This is one of the reasons why patients with acidosis have increased respiratory rate. The other main reason is to flush out the carbon dioxide, which I'll be explaining in the subsequent video. Applying the same concept at the tissue level, patient has acidosis, meaning patient has increased hydrogen ion, patient has acidosis, shift to the curve to the right. At the level of tissue, this phenomenon is very effective because the oxygen hemoglobin binding is decreased. So the hemoglobin releases oxygen quite freely to the tissue, and hence this is beneficial at the level of tissues. Conversely, let's apply the same phenomena. What happens when the hydrogen ion concentration decreases? So the pH increases. When the pH increases, there is shift of the oxygen hemoglobin dissociation curve to the left. What it means is there is increased binding of oxygen with hemoglobin. Now again, let us consider at two levels, at the level of alveoli and at the level of tissue. When this happens at the level of alveoli, it is very beneficial because whatever the patient is breathing in, the oxygen is readily combining with the hemoglobin. Applying the same concept at the level of tissue, this phenomena is not good. In alkalosis, there is shift of the hemoglobin dissociation curve to the left. It means the hemoglobin and oxygen affinity is quite strong and it is not releasing oxygen adequately to the tissue. Patients with alkalosis at the level of tissue go for hypoxia. And this is the major role of hydrogen on oxygen hemoglobin dissociation curve. Now we understood how vital this hydrogen is for the oxygen hemoglobin dissociation curve. The next thing that we shall discuss is the role of hydrogen on potassium. Potassium, as I discussed prior, is a major intracellular ion with a narrow range of 3.5 to 4.5 milliequivalents per liter. One of the most important role of potassium is on cardiac contractility. What happens when there is impairment of potassium from its normal ranges? It can result in cardiac arrhythmias and death of the patient. So what is the role of hydrogen ion on potassium levels? When there is increased hydrogen ion levels in the blood, in case of acidosis, what happens is the hydrogen that is there inside the blood exchanges with the potassium that is there inside the cell. So there is exchange of hydrogen from extracellular to the intracellular fluid for potassium. So the potassium inside the cell moves out into the extracellular fluid. This results in a relative hyperkalemia in case of acidosis. In alkalosis, the potassium is driven into the cell, resulting in hypokalemia. We have now understood the role of hydrogen ion on the human body. Need be for the enzymes to be active, for the proteins to be active to perform its normal physiological function, for oxidative phosphorylation where ATP generation is required, or the role of hydrogen ion on oxygen hemoglobin dissociation curve where it determines the binding of hemoglobin with oxygen at level of alveolar or at the level of tissue, as well as we have understood the concept of the role of hydrogen on the potassium. Now that we have understood the role of hydrogen ions at various cellular levels, we can now apply on our day-to-day clinical practice. When we are seeing an ABG and we see the pH, we can determine what is happening in the patient at that cellular level. We have to diagnose and treat the patient at cellular level and treat him at cellular level for effective outcome. Let's move to the next topic, which is acid. We shall briefly discuss regarding what an acid is. Acid are substances that are capable of donating protons. The examples are hydrochloric acid that gives hydrogen ion, and the other acid that we are going to frequently discuss in the upcoming video is regarding the carbonic acid, which is H2CO3. This dissociates to give hydrogen, H plus and HCO3, which is bicarbonate. Let's discuss what a base is. Base is any substance that is capable of accepting protons. The examples are the ammonia, which accepts proton to form ammonium. The other example is the bicarbonate, which binds with hydrogen ion to form the carbonic acid. Now, let's move on to regulation of pH. The pH is mainly regulated by three systems. One is the buffer system, second is the lung, third is the kidneys. These are the factors that regulate the pH. Among these, the blood buffers are the weakest, yet they are the first ones to correct the pH. Second is the lung. The lung plays a major role in control of the pH. Thirdly, the kidneys, they act on a later duration. They usually take hours to days to act. Let's discuss regarding the buffers. What is a buffer? A buffer is any substance that can reversibly bind to hydrogen ion. In simple words, buffer is a solution that tries to keep the pH within the normal range. There are two types of buffer which we shall discuss now. The first one is mixture of weak acid with their salt with a strong base. The second is mixture of weak bases with their salt with a strong acid. The examples are the bicarbonate buffer and phosphate buffer. Among these two, I shall explain in detail regarding the bicarbonate buffer. Let us discuss regarding the blood buffers. Here we have three types of blood buffers. One is the bicarbonate buffer system, second is the phosphate buffer system, the third is the protein buffer system. Among these three, bicarbonate buffer system is the one that we shall discuss in detail. The remaining two, phosphate and protein buffer systems, they don't play a major role, yet they are very essential at the level of kidneys. Let's discuss regarding the bicarbonate buffer system. In bicarbonate buffer system, it is the most important extracellular buffer. Here, the weak acid is the carbonic acid, which is H2CO3, and the bicarbonate salt is sodium bicarbonate. Let's have a look at few of the reactions that happens in the bicarbonate buffer system. Firstly, the carbon dioxide and water molecule in presence of carbonic anhydrase forms carbonic acid, which is H2CO3. The carbonic anhydrase is abundant at the level of alveoli as well as the renal tubules. This reaction is a reversible reaction. Carbonic acid is a weak acid and it is an unstable compound. The carbonic acid further dissociates into hydrogen ion and bicarbonate. This again is a reversible process. The base in the bicarbonate system is sodium bicarbonate. The sodium bicarbonate acts as a reservoir of the bicarbonate. So the sodium bicarbonate dissociates into sodium and the bicarbonate, which is HCO3. Let us combine all the reaction into a one single reaction, and this is how it follows. The carbon dioxide combines with water molecule in presence of carbonic anhydrase to form carbonic acid. This carbonic acid is unstable and can dissociate to form hydrogen ion and bicarbonate, which is given by the sodium bicarbonate. As well, this bicarbonate can combine with sodium to form sodium bicarbonate. The bicarbonate system in blood is a weak buffer system. This plays an important role when it comes to the proximal convoluted tubule in the kidneys. We have to always remember that the blood buffers are weak buffers. The main players in regulation of pH are by the lungs and the kidneys. Lungs do a major part in regulation of pH, which I'll be discussing ahead, and renals play again a major role, but it takes time from hours to days to compensate the change in pH. I'll briefly mention regarding the phosphate buffer system. The phosphate buffer system is predominantly an intracellular buffer as well as it is seen mainly in the renal tubules. The phosphate buffer system consists of an acid which is phosphoric acid H2PO4 and hydrogen phosphate which is HPO4. The phosphate buffer system plays a major role in the renals. The phosphate buffer system in blood is a weak buffer system, but its main role is there in the renal tubules. The third buffer system is the protein buffer system. And the commonest protein buffer in blood is within the RBC, the hemoglobin. Hemoglobin acts as a buffer and it combines with hydrogen ion. Now, let's move to the next topic, which is lung. Role of lung in regulation of pH. The main component that triggers regulation of pH via the lungs is carbon dioxide. Carbon dioxide acts as a main stimulus for ventilation. So let us now discuss regarding how carbon dioxide affects the ventilation. For this, we have to go back to the basic of respiration. We shall discuss regarding the respiratory centers. We have the respiratory centers in the brainstem. The sensory receptors are the peripheral chemoreceptors and the central chemoreceptors. The peripheral chemoreceptors are there in your aortic body and the carotid body. These receptors are sensitive for hydrogen ions as well as hypoxemia, whereas your central chemoreceptors are present in your brainstem. These receptors are sensitive to hydrogen ion, but the hydrogen ion in your blood cannot permeate through the blood-brain barrier to reach the central chemoreceptors. This is facilitated by carbon dioxide. So the carbon dioxide that is there in the blood can easily permeate through the blood-brain barrier. And once it dissociates through the blood-brain barrier, it undergoes a series of reactions to release hydrogen ions. These hydrogen ions in turn trigger the central receptors, the central respiratory center, and induce increased respiratory rate. And this increased respiratory rate flushes out the carbon dioxide. Let us have a look at the reaction. Here we can see that carbon dioxide combines with the water molecule H2O to form carbonic acid. The carbonic acid dissociates to form hydrogen ion and bicarbonate. And this hydrogen ion acts on the central chemoreceptors and triggers increased rate of respiration. If we look at this reaction, it is a reversible reaction in either ways. Conversely, when there is elevated hydrogen ions in the blood, the bicarbonate from the bicarbonate buffer system combines to form carbonic acid. This carbonic acid results in elevated carbon dioxide and H2O. So this carbon dioxide which is formed is exhaled via your expiration. From this, we realize that whenever hydrogen ion increases, it results in an end product of increased carbon dioxide. So by eliminating carbon dioxide, we can bring the pH back into the normal levels. That is the reason why whenever the hydrogen ion concentration in your blood increases, the carbon dioxide as well as increases. This carbon dioxide triggers your central receptors. The increased hydrogen ion triggers your peripheral receptors in your carotid and your aortic body. The carbon dioxide, it stimulates your central chemoreceptors. Both of them trigger your respiratory centers to wash out carbon dioxide so that excessive carbon dioxide is excreted and the hydrogen levels in the blood comes down. What this means is whenever there is acidosis, by stimulation of your peripheral and your central chemoreceptors, there is increased respiratory rate through which your lung regulate the pH of your blood by elimination of carbon dioxide. Conversely, whenever the hydrogen ion levels are low, it results in alkalosis. This triggers your respiratory centers to cause hypoventilation. When there is hypoventilation, there is retention of carbon dioxide, and once carbon dioxide is retained, you can see through the reaction, it can give rise to hydrogen ions. This is how lung plays a role in regulation of pH. So clinically, when we see a patient who is having increased respiratory rate, we can assume that he is trying to flush out carbon dioxide. So when carbon dioxide is flushed out, what results is alkalosis. In this scenario, it will be called as respiratory alkalosis. It is a compensatory mechanism to bring the pH back to the normal levels. Whereas when you observe a patient to have decreased respiratory rate, which is hypoventilation, you can expect the pH to be more acidic. Now let's move to the role of kidney in regulation of pH. Let me briefly tell about the mechanism one by one. So one is by reabsorption of bicarbonate. Whenever the pH in blood is low, meaning acidic, the renals try to compensate by retaining or reabsorbing the bicarbonate. This occurs in the proximal convoluted tubule. The other mechanism is by generation of new bicarbonate in the proximal convoluted tubules of the kidney. The other mechanism is by excretion of excessive hydrogen ions when there is increased hydrogen ion in your blood. The ways of excreting it can be via your phosphate or ammonium buffer. And in case of alkalosis, excessive bicarbonate can be excreted via your renals. By these mechanisms, the kidneys play a role in regulation of pH where it tries to retain the bicarbonate or excrete excessive hydrogen ions in case of acidosis, or it can excrete increased amount of bicarbonates in case of alkalosis. The renal regulation of pH takes hours to days to compensate the abnormal pH. The clinical application of the renal pathologies and associated metabolic disorders shall be discussed in the next video, which will be the pathophysiology and clinical manifestations in metabolic acidosis and alkalosis. To summarize, we have three factors that regulate the pH: the blood buffers, the lung, the kidney. Among this, the immediate acting is the blood buffer, but it is a weak buffer. The lung plays a major role. It is a major factor that regulates the pH and it is going to act immediately. Kidneys again plays a major role in regulation of pH, but it is having a delayed onset from hours to days to regulate and compensate the pH. Thus, we come to an end of the physiology of acid-base balance. These are my references. So that brings to the end of part 2 of ABG Simplified, which is Physiology of Acid-Base Balance. The next video is part 3 and it deals with the pathophysiology and clinical manifestation in metabolic acidosis and alkalosis. See you guys in the next video. Until then, everyone take care and please do stay safe in this pandemic.